Native American Community Clinic. We're a federally qualified healthcare center that provides the full spectrum of services to the Native population of South Minneapolis. We have some of the worst health outcomes in the state of Minnesota. C2 Dream is also known as the Center for Chronic Disease Reduction and Equity Promotion across Minnesota. The C2 Dream Center was an opportunity to build upon this idea, this vision that we would contribute to writing a different narrative of what Indigenous health and well-being looks like. We are one of 11 centers funded across the United States through NIH. The intention of those centers is to address structural racism as it contributes to chronic disease. The project that I'm on, that NAC is on, in partnership with the University of Minnesota, that is the only project across the entire United States that has an Indigenous focus. So much of the research that's produced in healthcare is focused on the things that contribute to our poor health outcome. Very little of the research that's done are about what is the root cause of those disparities, what are the things that bring us health and well-being. NAC, as the community lead in this project, we're working with 4 or 5 of our community partners, Indigenous-led organizations that are doing really unique work in Indigenous food, Indigenous games as it relates to improving health and well-being. And our specific project is we're working with those 4 or 5 partners to create a after-school program that we're delivering to Native kids in middle school. We know that being more physically active and eating better food changes your health outcomes. Well, that hasn't been the story for Native people and other people of color. And I happen to think that there's something else in that part that's missing that this project hopes to get to. This project was born out of a 3 or 4 year partnership with the university. We've spent the last 5 years working hard to center culture and tradition and knowledge at the core of what we do and sort of move it through the health system. I want to create a research center that says this is our path to health and well-being now and far into the future.